Now we go to Brazil. After overcoming a legal challenge from the far right, Brazil's first medical school course for agrarian reform settlement residents is underway. Our correspondent Brian Mier has more information.
In 1997, Brazil's social movements pressured the federal government to create university courses for youth in agrarian reform settlements and quilombolas, which are villages of descendants of people who escaped slavery. Since then, 190,000 people have gotten bachelor's degrees through the Pronera program. Now it's starting its first medical school course at Pernambuco Federal University.
We believe that Brazil's public universities, especially the Federal University of Pernambuco, need to address the structural problems in our society. When we look at rural areas, we understand that there are populations which still face barriers in accessing both university education and quality health care.
After 21 years, Pronera was cancelled by far-right President Jair Bolsonaro, but it was reinstated when Lula da Silva took office in 2023. When the government announced the new medical school program, however, a legal challenge was mounted to attempt to stop it from happening.
It's important to say that we never had any legal problems with our courses in areas like education and geography. But now this medical course bothers Brazil's elites.
Pedagogia, de geografia, agora quando o assunto é medicina, aí incomodou a elite brasileira. Então por isso que nós
This is why legal challenges are on the way, mainly from the right and the far right, who are attempting to cancel the medical school program.
The first legal hurdle was overcome this month when a federal regional court ruled in favor of Pronera. The plaintiffs still have a right to appeal to the Supreme Court, but the judges ordered that the program be allowed to start immediately.
The law and medical schools have always been occupied by the children of the rich in Brazil. This is why this bothers them. They don't want their children to study in the same spaces as the children of poor people.
Brazil's first medical program for agrarian reform settlement and quilombola residents is scheduled to start by the end of the month. Brian Mier, teleSUR, Caruaru, Pernambuco.